So nothing really changing on the ground, it seems. And meanwhile, the Indian Medical Association has taken cognizance of the rapidly increasing dengue crisis in the country and released suggestions of its own to follow on to curb the mosquito disease.
The Indian Medical Association has advised that most complications from dengue happen after the fever is over, and that the 2 days after the last episode of fever are crucial. The patient should be encouraged to take plenty of fluids, and that platelet transfusion is not needed unless the patient is actively bleeding. The Indian Medical Association also squashed any thoughts about this year's dengue crisis having become an epidemic. The AIIMS said there is a new suspected strain of dengue, where the risk of complications is in less than 1% of the cases. The World Health Organization has also released an advisory on what symptoms amongst patients should lead to hospitalization. Patients who are suffering from severe abdominal pain, persistent vomiting, lethargy, restlessness could consider hospitalization. If patients have an abrupt change from fever to hypothermia, or they are bleeding and they become pale in appearance, and even if limbs become clammy and cold, one could consider hospitalization. Liver enlargement on physical examination or abnormal mental status are also significant signs.